الحاضر الثاني الدكتور إبراهيم الحمدي، استشاري مياه بيضاء وزرقاء، المدير الطبي لمستشفيات مغربي في اليمن، حيتكلم عن دايابيتس ميليتس اند جلوكوما. طبعا الجلوكوما في اليمن هي ثاني سبب للعمى. نعم، وأول سبب العمى هو الكاتاراكت، واحتمال الكاتاراكت خلال السنوات تخف لأنه الأمريكان اكتشفوا قطرة تعالج الكاتاراكت. السبب الثالث هو الدايابيتيك ريتينوباثي.
السلام عليكم ورحمة الله وبركاته.
معك 10 دقائق.
12 يا دكتور.
في تخفيضات.
بطل حكاك، أنا داري بحركاتك هذا. بسم الله الرحمن الرحيم. Glaucoma is often referred to as the silent thief of the sight because it typically presents no symptoms until it causes significant damage. Glaucoma is characterized by progressive optic neuropathy and optic nerve head damage with visual field loss. Glaucoma is a group of eye diseases that damages the optic nerve, often linked to high intraocular pressure. Glaucoma can cause vision loss and eventually blindness. Living with diabetes comes with various health challenges, and one of the most significant risks is the potential impact on your vision. Diabetes impacts the blood vessels all over your body, including those that supply your eyes. High blood sugar levels can damage the tiny blood vessels in the retina, leading to diabetic retinopathy and increasing your risk of glaucoma. Additionally, diabetes can lead to the formation of abnormal blood vessels in the eye, which can contribute to elevated intraocular pressure. As a result, managing blood sugar levels is critical to reduce your risk of developing glaucoma and other eye-related issues. Studies show that individuals with diabetes are twice as likely to develop glaucoma compared to those without the condition. The two most common forms of glaucoma are open-angle glaucoma and angle closure glaucoma. Open-angle glaucoma is characterized by a slow blocking of the drainage canals in the eye, which leads to increased the pressure. Angle closure glaucoma is when the drainage angle between the cornea and iris becomes blocked or closes suddenly. People with diabetes are more likely to develop open-angle glaucoma compared to angle closure glaucoma, though they are at increased risk for both forms. Open-angle glaucoma progress gradually and often without symptoms, which makes regular eye exams especially important for diabetics to catch any changes early. Diabetes and ocular complications that can be caused by diabetes, like glaucoma, cataract, diabetic macular edema, diabetic retinopathy, ocular surface disorders like dry eye, diabetic papillopathy, optic nerve swelling, ocular motility disorders like problems with eye movement due to nerve damage. These conditions damage the blood vessels in and around the eye, which can lead to vision loss or blindness if left untreated. Managing diabetes and controlling the blood pressure and getting a regular dilated eye exams are crucial for early detection and prevention. Epidemiology: people with diabetes have approximately twice the risk to develop glaucoma. The risk is associated with both the presence of diabetes and the duration of the disease, with some studies also linking higher blood sugar levels to an increased risk. Poor controlled diabetes can lead to neovascular glaucoma, a severe form caused by new blood vessels growth in the eye, often stemming from diabetic retinopathy. Blood sugar levels: higher fasting glucose and glycated hemoglobin levels are associated with an increased risk of developing glaucoma. Types of glaucoma like neovascular glaucoma and standard open-angle glaucoma. Mechanism linking diabetes to glaucoma: vascular damage, oxidative stress, inflammation, and impaired drainage. This is the relation between the diabetes and glaucoma. Vascular damage: reduced blood flow. Diabetes can cause microvascular damage and vascular dysregulation, which may compromise the blood supply to the optic nerve head, making it more vulnerable to damage. Abnormal blood vessel growth: in advanced cases, damage to blood vessels from high glucose levels can cause them to grow abnormally in the iris and drainage angle, leading to neovascular glaucoma. Oxidative stress: both diabetes and glaucoma are associated with oxidative stress, a process that may contribute to the development and progression of both conditions. Inflammatory response: chronic inflammation associated with diabetes can affect various parts of the eye, including the trabecular meshwork, which can lead to increased intraocular pressure. Impaired drainage and elevated intraocular pressure: Blocked drainage, abnormal of the vessels, or an accumulation of glycoprotein called fibronectin can block the eye's natural drainage system, causing fluid to build up and pressure inside the eye increase. Trabecular meshwork dysfunction, high blood sugar can directly disrupt the function of the trabecular meshwork, the eye's primary drainage system, leading to increased intraocular pressure. The patient comes to the clinic with severe pain, mid-dilated pupil, neovascularization at the iris and the angle, and of course decrease in the vision. In the second photo, it may come with complicated cataract, which makes the treatment and management of the retina difficult to the retinal surgeon. Also may come with distortion of the pupil and ectropion UV. The synovial angle closure by blocking of the vessels at the angle. When doing the investigation, we can see rebuses iridis, the slit lamp microscopy of the anterior segment of the eye. When we do fluorescein angiography, we can see the ischemia in the retina, and we can do also OCT showing the ischemic parts in the retina. This shows the development of the abnormal blood vessels when we do fundus photography. And this is the end stage of the patient. The prognosis is very, very bad. يعني the patients may reach this stage in many cases. ويروح طبعا ثاني يوم اشتكينا للمجلس الطبي، وتحاول تفهم، تقول طيب يعني اشتكي معنا دكتور السكر ودكتور الريتنا، لانه مر عليهم يعني في البدايه، يقول والله ما غريم الا انت، يعني انا جيت وعد في شويه نظر واتصيت عندك. احنا للاسف دكاتره الجلوكوما يعني المظلومين في الموضوع. مانجمنت اوف نيوفاسكولار جلوكوما زي ما اتفقنا لازم يمر على دكتور الباطني، دكتور السكر، دكتور الريتنا، يعني وبعدها يجي عندنا زي ما قال تتص عندنا. The management of neovascular glaucoma may be challenging and frustrating, often requiring the cooperation of retinal and glaucoma specialists. The primary key principles of neovascular glaucoma management are divided into two different directions: treatment of underlying disease that lead to the ischemic insult that initiated the anterior segment neovascularization, performing PRP or pan-retinal photocoagulation, and or intravitreal anti-vascular endothelial growth factor injections. Then controlling high intraocular pressure by the glaucoma specialist by topical and systemic pharmacological medications or surgical interventions to avoid the damage of the optic nerve. Pan-retinal photocoagulation, it is a procedure of choice for ischemic retinal disease, and it has been shown to reduce and eliminate anterior segment neovascularization. PRP may stabilize the intraocular pressure in the open angle glaucoma stage of neovascular glaucoma and may improve the outcome of filtration surgery if performed preoperatively. This is the argon laser, the laser which used for by retinal surgeons to do the PRP, and this is photos may be shown later by retinal surgeons of the retina sparing the macular area and the optic nerve. Another picture. Treatment of elevated intraocular pressure by the glaucoma specialist. First, pharmacologically by beta blockers, dorzolamide. We don't like the prostaglandins. It is not effective and may increase the inflammation. Topical corticosteroids for inflammation and cycloplegic agents for pain control. Osmotic agents may provide acute but transient lowering intraocular pressure by reducing the vitreous volume. Most cases of neovascular glaucoma refractory to pharmacological treatment and require surgical intervention if early diagnosed or prophylactic treatment with PRP is delayed. Surgical intervention may be by trabeculectomy or PRP treatment and aqueous drainage implants. Trabeculectomy has limited success and may be associated with various complications such as intraoperative bleeding and progression of fibrovascular membrane postoperatively. PRP treatment reduce the active neovascularization at the iris and neovascularization at the angle, may decrease intra and postoperative complications. The use of antimetabolites may improve the outcome. Tsai and colleagues reported a success rate only of approximately 30% at 5 years with the use of 5-fluorouracil at the time of trabeculectomy. Aqueous drainage implants, as with glaucoma filtration surgery, success rates decrease over time, unfortunately. No significant differences have been noted among the various types of implants. Mermud and co-workers used multino implants in 60 eyes with neovascular glaucoma, reported success rate only of 62% at 1 year, but only 10% at 5 years. Usually the prognosis is very bad. Cyclodestruction by diode lasers. The procedure of cyclodestructives using either neodymium or diode lasers have been used to destroy the ciliary body to reduce the aqueous humor production. Although these laser procedures may have a lower complication rate compared with cyclocryotherapy, the number of eyes with significant visual loss remains high, and the long-term success rate and treatment protocol are not well established. Some updates in neovascular glaucoma are the neurodegeneration, accelerated damage. Some research suggests diabetes may accelerate the natural neurodegenerative processes in the retina and optic nerve, which could increase the risk of glaucomatous damage. Enhanced protocol. A new protocol called the scoping protocol standardizes the treatment by combining 6 monthly anti-vascular endothelial growth factor injections with interspersed PRP and adapting surgical strategies based on the eye's angle anatomy. Surgical and procedure updates. Safer cyclodestructive methods. Newer, less invasive procedures like transscleral micropulse and endoscopic cyclophotocoagulation offers alternatives with reduced complications compared to traditional methods. Filtration surgeries, standard procedures like trabeculectomy, and the use of glaucoma drainage devices are still viable, offering good results. Thank you.
شكرا دكتور إبراهيم. Our next speaker is